to answer. My name is Collette Byrne. I'm National Advocacy Manager at OCD Action, and I'm going to give you some information about our advocacy service, which is open to adults with OCD and BDD. Then I'm going to tell you a bit about accessing CBT in the community, and then Simon and Anna will give you a bit more information about good CBT and the national and specialist services available in the UK. Okay, our advocacy service, we've got two members of staff, myself and a part-time colleague. I'm based in London, part-time colleague Kenna is in Liverpool. We provide individual advocacy across the UK via telephone and email service, and we have a team, or we will have a team of 20 volunteers who can also provide face-to-face advocacy, mainly in England. And we're also, because we've just received 5 years funding from the Big Lottery Fund, we're going to be looking at doing national advocacy as well, which is looking really at trends across England, looking at models of good practice with treatment of OCD and BDD, you know, good employers, things like that. So more of a sort of campaigning and policy role. So the advocacy model we work to is working with adults, so anybody over 18, with the diagnosis of OCD or BDD, and people who have a specific issue that's directly related to that diagnosis, and who are able to instruct an advocate. The advocacy that we provide is short-term and it's issue-based. So if I sort of expand on that a bit, the sort of support that our advocates provide, we can give you information, we can make phone calls on your behalf, write letters, prepare statements, attend meetings, and sometimes put people in touch with specialist advice services, because it may be that your issue really, you need legal support, and that's the sort of thing we could put you in touch with. So the kinds of things that we take on as an advocacy service, and these are just examples. I mean, you know, we would consider taking on anything that you really needed support with that was a specific issue. So we do a lot of employment work where people are struggling with their employers because the employer doesn't understand the nature of someone's OCD or BDD. About 60% of the work that we do is supporting people to get appropriate care and treatment for their OCD or their BDD. And we do that generally by writing letters, going to meetings with people, sometimes educating their clinicians as to the type of treatment that the individual should be getting. We do a lot of work around housing, again, where people are struggling with their housing provider understanding the nature of their condition. Education, where people are struggling to remain at university perhaps or attend lectures. And then generally where people are facing discrimination, and we would support people who are needing legal advice and representation. So to give you, to flesh it out a bit more, give you more of an idea of the sorts of things that we do, for example, with housing, I mean, some of these are, I suppose, OCD examples more than BDD, but the sorts of things we've done is liaised on behalf of tenants to have adjustments put in place where they're having their gas or electricity supply inspected. So we do a lot of work around the Equality Act, obviously, and making sure that service providers are aware that OCD and BDD meet the definition of a protected characteristic, of disability under the Equality Act, and that the service provider has a statutory duty to consider reasonable adjustments for that individual. With care and treatment, we have had some success securing referrals to national and specialist services for people. Where previously they've struggled to persuade their clinician to refer them or to seek funding for that. Similarly with employment, you know, it's supporting someone to be able to remain in work or to return to work. So it might be we're negotiating on, you know, with them and on their behalf a gradual, phased return to work, for example. And similarly with education, again, using the Equality Act, we've negotiated reasonable adjustments for clients around coursework deadlines and exams, for instance. So to access the service, you just need to email us or ring us up. We have a referral form on the OCD Action website. We've got some referral forms on our desk today. And then the other thing I would just ask you is we're currently looking for people to volunteer to be advocates. We'd be very interested in having anybody apply. I mean, our focus is England, but we wouldn't turn down people who are outside England. Our big lottery funding is for England, but as an organisation, we are very focused on providing advocacy for the whole of the UK. And if you wanted to ask more questions about the advocacy role, do catch me and ask me some questions. The other thing we're looking for, and this would be for London-based people at the moment, are helpline volunteers. So similarly, if that's something you're interested in, ask me and I'll talk to you about it. Okay, so that's sort of a very broad overview of the advocacy service. And now I wanted just to talk about accessing CBT in the community. So looking at where you might get CBT for BDD in the community. So the areas that I'm going to look at, and then I'll hand over to Simon and Anna, are improving access to psychological therapy services, or IAPT. Going to talk a bit about the NHS choice framework. I don't know how many of you are aware of those changes that have taken place to the NHS constitution recently. And then community mental health teams or child and adolescent mental health services, and then the private option. Sorry, it's me not being very... So looking at improving access to psychological therapies, you are probably, all of you in England, aware of them. They are sometimes, or most often, not called IAPT services. They'll be called, I don't know, healthy living or, I don't know, working together or something. They've always got these kind of groovy titles. But they're services that were set up across England to provide CBT and other therapies for adults who are experiencing generally mild to moderate anxiety, some sort of anxiety disorder and depression. So that was the sort of the general aim of them. Within the services, though, they do have what are called high-intensity cognitive behavioural therapists. And very often we get contacted on the helpline by people who have fairly severe OCD, and what they're being offered is, say, group therapy, group CBT, when what they really need is somebody with a bit more experience, both of CBT, but also of OCD or BDD specific CBT. These high-intensity CBT therapists, their CBT training has been accredited by the BABCP, the British Association of Behavioural and Cognitive Psychotherapies. And their aim, or their expertise, is in treating moderate to severe OCD for definite, and possibly BDD. But this is the sort of information I think that you need to be seeking when you're getting a referral or you're referring yourself to your IAPT service. What have they got available? Because there will be a wait once you're referred. Some areas you can self-refer, other areas you need to go through your GP. But it's about asking your GP for that information. You can ring up IAPT services and ask them, what am I going to get you know, and to be clear about what it is that you need. So waiting times vary across the country. Sometimes there's a wait for an initial assessment, and then there's a further wait for you to start treatment. But it's really important that you have that information so you can make the decision as to whether this is something, you know, worth pursuing, and what you're waiting for. Information about your local IAPT services are on the NHS Choices website now. The other option available to you, so you could go to your GP, they could refer you on to an IAPT service, or you could exercise this expanded legal right now you have to choose provider and consultant-led community team of your choice. This is only for England, and it's for anybody over 16 who has the capacity to make that decision. So what is supposed to happen is that you would go to your GP and talk about the CBT that you want, either OCD specific or BDD specific, or a bit of both, and they should be able to provide you with information as to where you might be referred to, and that could be anywhere in England. Although this is something that came out in April 2014, it's something that's still very new. Lots of GPs don't seem to know about it. Lots of the people we talk to on the helpline don't seem to know about it. There's information on our website about it, and what I suggest to people is that you print up guidance that was provided for GPs and clinical commissioning groups, you know, the commissioners who are paying for services. Guidance was produced the beginning of this year, and print it up, take it to your GP. It's your you know, you have this legal right. It's now been put in the NHS Constitution, and to exercise that right. If you're receiving treatment from a community mental health team, then you don't have this right. So this is for people, you might have had treatment from the community mental health team in the past, but if you're discharged and you're not at the time that you're getting the referral, then that's your right. So for example, you could ask your GP to refer you, say, to David Veal's team at the Maudsley. And depending on what your local IAPT service is able to provide, that might be a better option than you know, to go to somewhere like the Maudsley than to be waiting to see, you know, your local IAPT service that might not have much in the way of expertise. So the other source, obviously, of CBT is through your community mental health team, if you're an adult, or through the Child and Adolescent Mental Health Service, or CAMS, if you're under 18. They may well have a clinical psychologist. They're multidisciplinary teams. They would generally, as I say, have some sort of psychologist in the team, or they would be linked into the local psychology departments. Again, there are variable waiting times, variable level of resources. It's not always that they might have a psychologist, but the psychologist might not have any expertise in CBT or in CBT that's specific for OCD or BDD. But again, this is information that your GP should have. Your GP is the person who would refer you to the community mental health team. Find out. The other route that unfortunately lots of people feel is the only one open to them due to availability of CBT, experienced CBT practitioners within the NHS, is to go down the private route. And what we suggest is that people look on the British Association for Behavioural and Cognitive Psychotherapy's website, which is the accreditation organisation for CBT. And you can put in there, you can do a geographical search and also a search on, you know, what someone's experience is or the kind of conditions that they work with. So, I mean, I would say, and this is what we would tell people on the helpline or through the advocacy service, if you're embarking on CBT, you know, gather as much information as you can about where you are in the stage of the, you know, of the NICE guidelines on the step care model, you know, the NICE guideline details, the sort of level, the intensity of the CBT that you should be having. Find out what's available, what are you being offered. Inform yourself as to what is good CBT, which Simon will tell you about in a minute, and find out too what you have to do. I mean, you know, read support books, look on our website, the website of the BDD Foundation, so you've got as much information as to what you're going to have to do, because it's, you know, it is hard work. And things to think about, and this is whether you're seeing a therapist within the NHS or privately. What experience does the therapist have? Have they worked effectively with someone with OCD or BDD before? How do they plan to work with you? There is unfortunately a lot of stuff out there that's called CBT that isn't really CBT when it comes down to it. And it's really important that you're going to get on with this person. So, you know, if you can, meet with a therapist, speak to them on the phone. Do you like them? Are you going to like them? Are you going to be able to work with them? And don't be afraid to shop around. I know that's much more difficult within the NHS, but it's important that, you know, it's so important who the therapist is and that you're going to be able to work with them. That's, you know, it make a difference between, you know, you getting better and not, unfortunately. If things don't go well, for example, if it's not CBT, and there is information on our website at OCD Action and on the BDD Foundation's website about what good CBT should look like. But if you find you can't work with a therapist, you can't manage the homework, the CBT is too challenging, you know, in those situations, really do talk to your therapist and see if something can be resolved at that level. There is support and information, as I say, on our helpline and on the, our website and the BDD Foundation's website. We also, at OCD Action, we have what's called a Next Step service, which is part of our helpline. And this is where you'll be paired with a helpline volunteer for the duration of your CBT treatment. So we will put you with a helpline volunteer who will ring you perhaps every week through your course of CBT up to about a month afterwards. And the aim of that is to keep you motivated and engaged with the CBT. We're not therapists, that isn't what we're offering, but it's to, you know, to try and support you to keep going. If you're having, you know, real problems finding appropriate services locally, then do contact us and the advocacy service can work with you. And then, you know, finally, as I suggested before, get some self-help books, you know, find out what should be happening and how it should work. And we've got lots of resources on our website, as does the BDD Foundation. Make use of them, you know, call us up, use the helpline. We'd be happy to help. Okay, that was me. I'm going to hand over to Simon and Anna.